The blood pressure is one of the most talked about health numbers and also one of the most misunderstood. People often hear your blood pressure is high and immediately jump to two extremes. Some panic, imagining stroke, heart attack. Others brush it off completely because they feel fine. Neither approach help. So, let's slow this right down and walk through it properly. What hypertension really is, how it is diagnosed, why it matters, and how it is treated, including lifestyle changes that actually work. No myth, no drama, just understanding. Blood pressure is simply the force of blood pushing against your artery when the heart beats. It is written as two numbers. The top number is the systolic, which represents the pressure when your heart squeezes, and the bottom number is the diastolic, which represents the pressure when your heart relaxes in between beats. Hypertension means that this pressure is consistently high over time. That word consistently is crucial. A single high reading does not equal hypertension. You may get a high number because you were stressed, you were rushing, in pain, had caffeine, or you were anxious during the appointment.
So one bad number doesn't mean I'm in trouble.
Correct. Hypertension is a pattern, not a moment. I often explain it like this. If we think about blood pressure as the water pressure in plumbing, a brief surge doesn't damage the pipes, but pressure that stays high day after day slowly causes wear and tear. So how do we diagnose hypertension correctly? It starts with good measurement. A reliable clinic reading should be taken in a calm environment, with the person seated, arms supported, and using the correct cuff size. Often, blood pressure is measured more than once and in both arms. This is not overkill, it's just for accuracy. If clinic readings are raised, but not dangerously high, we don't rush to label it. Instead, we confirm the pattern by doing blood pressure reading outside the clinic settings, either with a 24 hours ambulatory monitor or a structured home blood pressure reading over several days. This matters because clinic readings can sometimes be misleading. Some people run high in clinic and they are fine at home, while some people look fine in the clinic and are consistently high at home.
So the home number actually matters more than the one at the GP?
Often yes, they show what your blood pressure is doing in real life. If the blood pressure is extremely high, the question then becomes whether it is doing actual damages. So we check for things like new chest pain, severe breathlessness, confusion, collapse, or neurological symptoms. This is when urgent assessment is needed. But most of the time, hypertension is important but not urgent, and that distinction is key. Now let's talk about why hypertension matters, even though you feel completely fine. High blood pressure is often symptomless. People can walk around for several years feeling normal, but over time, untreated hypertension increases the risk of having a stroke, heart attack, heart failure, chronic kidney disease, damage to the eyes, and problems with memory and thinking later in life. I usually describe it as a slow, invisible strain, like rust forming quietly. You don't notice it day to day, but over time it weakens the structure. This is why when hypertension is suspected or confirmed, we usually test for end organ damages. Things like kidney tests, urine tests, heart tracing, and sometimes eye examination. Not to scare people, but to understand the risk and the impact, and to guide treatments accordingly. So how is hypertension treated? Treatment has two equally important parts: lifestyle changes and medication when needed. Let's start with lifestyle, because this is not soft advice, it actually works. Reducing salt intake is one of the most important parts in blood pressure management. Most salt comes from packaged and processed food, not from the salt shakers. Cutting this down can significantly improve our blood pressure. Weight management matters as well, because even modest weight loss can improve the blood pressure significantly. Regular physical activities help, not extreme exercise, but consistent movement. Alcohol reduction is important if your intake is high. Cutting back lowers the blood pressure and reduces your overall cardiovascular risk. Caffeine awareness matters as well. If consumption is high or you're sensitive, reducing it can also help. Smoking cessation doesn't just protect the blood pressure, it also protects the blood vessels, the heart, and the brain.
Oh, if I meditate hard enough, can I ignore the salt and the alcohol?
No. Relaxation techniques can help some people feel better, but the strongest evidence is for the fundamentals. Lifestyle work when it is practical, not magical. Medication comes into play when the blood pressure remains high, despite lifestyle modifications, or when the overall cardiovascular risk is significant, or when there's an evidence of organ strain. Medication is not a failure, it's a tool to help reduce overall long-term risk. Treatment is usually started gradually and adjusted over time, and guided by follow-up readings, often using the home blood pressure readings. I like to think of blood pressure control like adjusting a thermostat. You don't just slam it to the extremes. You set a target, check, adjust, and maintain. The target can vary slightly by age or how the reading is taken, but the principle is still the same: steady, safe control over time. So here's the takeaway I want you to remember. Hypertension is not a single scary number. It's a pattern, but it's manageable. With proper diagnosis, sensible lifestyle changes, and medication when needed, most people can dramatically reduce their risk and live well.
So, no panic then?
Exactly. Understanding first, consistency second. No panic required. If this has helped make hypertension less confusing, please subscribe. And if there's a symptom or condition you would like me to explain next, please drop it in the comment section. Stay safe and see you next time.